Hi, I'm Dr. Latino Feliz, and today we're going to discuss how to assess the ankle after an acute injury. So one of the things we want to look at is how are we walking, right? Because usually when we hurt our ankle, there is a change, or sometimes there's a shift in the way you walk. You want to focus on properly driving the heel, stepping down on the whole foot, and going through this heel-toe motion. So initially, just kind of looking at people when they're walking is going to be something that I look at, or I'll have them do this rocking back and forth, where one foot is forward and we go through that heel-toe motion. And so sometimes what you'll see is that when someone walks, like the moment they put weight on their foot, they'll start limping, or they can't wait there, or they can't push through, and that's painful. So we want to see at what part of that gait cycle or what part of that motion do you have pain in your ankle. Next, we're going to look at another assessment that I like to look at when we're looking at analyzing the mobility in the ankle. So this is called a tall toe sit, tall kneel toe sit. So we're on our knees, and then you want to tuck your toes underneath. Actually, doing this and sitting back will also look at range of motion. So there's two ways to do this, but we're going to do this one first. So you're going to tuck your toes and you're going to try to sit down on your heels. And ideally, if there's no issue in the ankle, this typically is not painful. But sometimes we'll find that just even getting into this position is painful, or coming down, you'll feel a little pulling in the Achilles tendon. Or if you're here, like some people can assume and don't have that much plantar flexion, so that movement will be painful. If that's you, then you're just gonna kind of be aware of that, don't force it, and then we'll do other things that'll help manage that. So another assessment that I like to do is a T. So when we think about a T, right, you have this and then you have this. So you wanna think side to side and then up and down. And so we're gonna move the ankle first, coming up and coming down, also known as dorsiflexion and plantar flexion. So I'm using a block here just to have a little bit of room so that my ankle doesn't hit the ground. And then I wanna pull my foot towards me, and then I want to point the toe down. So typically, sometimes if there's any kind of swelling, range of motion will be limited, either going up or going down, and we want to take a look at that. So as far up as you can bring your toes, and then as far down as you can point your toes and move that ankle down. Next, we're going to look at side to side. You want to move your ankle in and out. So this is inversion and this is eversion. So we want to kind of windshield wipe that foot in and out. And then make sure you can put your hand on your knee to make sure that you're not using the knee or the hip to actually rotate. So it's solely just the ankle. This is an easy way to kind of just check in and see, are my ankles healthy? Do I have the full range of motion that's necessary? And if you don't, we're gonna go into some exercises that will help increase your mobility for the ankle. The next thing we're gonna do is go into mobility exercises that are gonna help get you to move your ankle as it should. So you want to go ahead and prop yourself up on a block, and you're going to start first with just an ankle pump. So pretend like you're pushing your foot on a gas pedal. So now up and down, and just like that. So let's say you do have pain, you want to work in a pain-free range. So don't go as far. But once it starts feeling pretty good, you can pump that ankle. This is good for mobility. This is good for circulation too. If you're ever on a plane, you can do this too, okay? So start with about 2 to 3 sets of 10 on each side. The next exercise is gonna be windshield wipers. So what we wanna do here, propping the foot up on a block, you're just gonna bring your foot inward and out. You want to get a little bit more. Inversion is typically coupled with plantar flexion, so kind of bring that foot down a little bit and then out. And you do this again 2 to 3 sets of 10 for a total of 20 to 30 reps. The next mobility drill is going to be knee to wall. So what we want to do, we want to go about 1/5 and part of your thumb away from the wall. So we want to put that distance. I'm going to bring this back a little bit. So that's where my toe is going to go. And then I want to try to bring my knee to the wall. So most of my weight is on my left leg and on my hands. And I'm just guiding that knee. And if this is too far away, you can just go a fist, get a little closer. And again, try to keep that heel down and try to get your knee to touch your wall. So this is gonna help with mobility in the ankle, getting you a little bit more what's called dorsiflexion, which is so important for any jumping, walking, running drills that you do. And so you wanna dose this at about 30 to 50 reps. And I have patients that are pretty limited, do this twice a day. Straight forward and then bring it back. All right, so the next exercise that we're gonna do is gonna be an assisted calf raise. So really important in being able to start loading that heel and that ankle, especially because when we walk, you need to be able to push off. But sometimes the leg isn't quite ready, the ankle isn't quite ready. So this is an exercise that I like to start off with. You can go ahead and come off a step so that the heels are off your step. And so let's say my right leg is the one that's injured. I wanna go ahead and come up with my right, but then my left leg is also helping me out. So instead of me evenly distributing my weight between both sides, most of my weight is actually on my left leg, and my right leg is gonna push as much as it can pain-free. So my left leg is assisting my right leg in this motion. So again, I'm pushing off more with the left, and I'm trying to get those heels all the way up. And if you can, try to go a little below that baseline level. You can go a little bit past neutral. And the goal here is to try to get both sides symmetrical. And eventually the progression would be coming up for 2, down for 1, up for 2, down for 1, and then eventually a single leg calf raise. As you begin to heal, one of the things that you want to get your body used to is actually weight bearing on the side that is uncomfortable. So what you want to do here is keep your feet about hip width apart and just shift your weight to the right and to the left. All the weight on the right leg, all the weight on the left leg, where eventually you should be able to load pain-free on that right side and kind of lift that other foot to give you a little bit of a sense of confidence with putting weight on your leg. And then a progression to this would be just rocking back and forth. So rocking back, rocking forward as if you're walking, and then stepping through, rocking back. So that would be a progression to that. And the way we would dose this is about 30 reps back and forth, 30 reps side to side. And you can switch, so right now my right leg is in front, so then I'd switch left leg in front. And then do the same motion, because this replicates our ability to walk. That concludes the video on being able to decrease pain and increase mobility after an acute ankle injury. And remember, these exercises do not substitute professional medical advice. These are just things that I typically use with athletes that I work with that have gotten great results. And if you have any questions, you can always reach out to us, either DM us, shoot me an email, and we're happy to set up a discovery call to get you started.